Are you overwhelmed caring for an aging loved one? Whether you're an adult child, spouse, partner, friend, or a professional caregiver, then this podcast is for you. Welcome to your Silver Lining. Each week, we bring you valuable content to help you provide the best care and support possible, along with tips on how to care for yourself. Your Silver Lining hosts will cover topics such as recognizing when a loved one needs help, advocating for them in the emergency room, managing medications, maintaining fluid and nutritional balance, handling acute and chronic diseases, and much more. And now for the disclaimer. Keep in mind the information you are about to hear should not be misconstrued as medical or legal advice. See the full disclaimer below. And now on to the show with your hosts, Stephanie and Paige.
Hello and welcome back. My name is Stephanie Cameron and I'm your nurse care manager. I'm also the owner and founder of Transitions Care Management, a concierge care management practice here in the Seattle, Washington area. And I'm excited to sit here with my awesome co-host, Paige. Who's also our operations manager for Transitions Care Management. And we're excited, as always, to bring you today's topic. We are going to talk about how you know when your loved one needs help. Sometimes it's obvious, sometimes it's not.
Yeah, important to know.
So let's dive right in.
Yeah, let's do this. So why is it important to recognize when a loved one might need help?
Yeah, so I think early identification allows for timely intervention, potentially preventing minor issues from escalating into something really big. We tend to kind of write off minor things that might be of concern, but we also don't want to raise alarm bells for something that's not concerning and just kind of being human, right? You know, who hasn't forgotten where they leave their keys from time to time.
Right.
So we're going to help you understand the difference between normal aging, temporary conditions, long-term problems that can, if addressed, can really improve the quality of life for our aging loved ones and then reduce the amount of caregiver strain. Now, we want to tell you that this is going to be actually a brief conversation. Each one of the things that we discuss within today's podcast can probably go into a full podcast on its own. So we're going to give you kind of the 30,000 foot overview today on how to recognize when a loved one needs help, and encourage you to stay tuned and check back often for the episodes that are going to expand on the topics we talk about today.
We'll be doing them.
Mm-hmm.
We'll be doing them. And you can leave us comments to, if one of the things that we did talk about you want to expand on, it'd be good information for us to have.
Please do. We welcome your comments. You
right. We're going to lay this out in levels of concern. So we'll start with what are some of the subtle signs that a loved one might need help, but don't necessarily indicate an immediate problem.
Yeah, great question. And I love that idea of putting things at the levels of concern. So things like occasional forgetfulness, minor withdrawal from social activities, a slightly cluttered home that may not require urgent action, like somebody who kept a really clean house and maybe it's just not as tidy as they used to keep it. Regular conversations and observations can really help detect patterns and subtleties that might indicate a more serious concern. So paying attention now.
What signs indicate a situation is becoming a red flag that might require intervention?
Yeah, so things like increased confusion, noticeable weight loss, trouble keeping track of medications, unpaid bills, difficulty maintaining personal hygiene, that could suggest a declining health or cognitive issue. So yeah, they might warrant further evaluation.
Yeah, and on that weight loss point, I have a funny story. My mother-in-law needed to lose a little bit of weight. And when she did so, we were like, hey, you look great. That's so good. Well, it was an underlying problem, actually, that she couldn't reach her pots and pans. So she wasn't cooking.
Yeah. And who would know? I mean, you ended up discovering it, but it's not something that was obvious right away. So some of these changes we might be seeing, there may be a subtle underlying cause of it. And so being observant, kind of really watching out for things you may not expect, just keeping your eyes and ears open if somebody is changing a bit.
Yeah, exactly.
Mhm.
And when does a situation become an emergency requiring immediate action?
Yeah, sudden increase in confusion, right? It comes on very quickly. Disorientation, falls that result in injury, refusing to eat or drink, or evidence of self-neglect. Those require immediate medical attention. That's not something you want to just sit and observe.
And in recognizing signs your loved one may need help, I kind of want to break this down into categories a little bit.
Sure.
So my first question, it really it's about behavior and what behavioral changes might suggest a loved one is struggling.
Yeah. So we're going to actually talk about behavior, physical, and environmental changes. And so to address your question about behavior, these could be things like lack of motivation, loss of interest in activities they once enjoyed. They used to like gardening and now it's full of weeds. They just don't care to go out anymore. Increased agitation, changes in sleep patterns, that can indicate underlying mental health or cognitive issues or depression, early stage dementia. So there's a lot of things you can look out for. One of the other behavioral social ones are not going out as much. Like they used to go to the senior center a couple days a week. Now they're not going anymore. Making excuses not to see friends or attend family events. These are all things we want to pay attention to.
Oh, yeah.
Mm-hmm.
And what physical health changes could signal a senior needs assistance?
Yeah, sudden weight fluctuations is a big one. More often it's losing weight than gaining for various reasons. Difficulty with mobility, frailty, signs of medication misuse. When somebody has polypharmacy, a number of medications on board, if they are beginning to decline or having other issues, having medication compliance can be more challenging. But the thing is when you're not feeling good and you're not taking your medications properly, then you're not going to be doing well because you're not taking your medications properly. And it can be kind of a vicious cycle there. So these are changes that really need to be addressed by a healthcare provider as you see them. It's probably not so much a sit and wait. It warrants at least a phone call for some guidance.
Yeah. Whereas maybe the behavioral changes, I mean, I guess you'd want to consult your physician for that one as well, but it might be something that you can start to help with.
Yeah. So that's actually a really, really good point. So when do you call the doctor, right? If mom's just not as interested in being as social, do you need to call the doctor right away, or do you need to maybe see if you can help provide a little bit more psychosocial support for her, that she just needs a little bit different level of engagement? Definitely something to note to report to the doctor when you see them, but is it something you want to make a separate phone call for? No, I mean, you can be the judge of that and feel how emergent it sounds, but oftentimes it might be just a shift in how we provide that psychosocial stimulation too.
Call your mom.
Call your mom. I love that.
How can changes in a person's home environment signal that they may need help?
Yeah, this is a really good one because for somebody, as we mentioned before, who maybe kept a really nice house, maybe it's becoming more cluttered, or they're wearing a tank top and it is the middle of winter, right? So, how are they dressing? How are they presenting? We call it, are they dressed appropriately for the season? Or unpaid bills piling up on the counter, or any utilities been shut off. And the thing is something that might go along with this are excuses. So things like, I just, I'm not worried about cleaning the house. I don't entertain anymore. I'm not worried about it. And so there will be oftentimes very legitimate sounding reasons why some of these things are happening, where it's really a compensation tactic for, I'm not going to let on to anybody that I'm feeling overwhelmed or frustrated by paying bills, by cleaning my house, by bathing.
Yeah. And also, I think another important thing to note is if your loved one is only living on one level of like a 2-level house.
Yeah, we have seen that.
But yeah, that's another one.
Mm-hmm. So again, observation.
Yeah. Now let's explore some of the potential causes behind chronic decline.
Mm-hmm.
Are there temporary or treatable conditions that could mimic cognitive decline?
Yeah, so there are some that can contribute and make it feel like a chronic decline when it's not. It's actually an acute cause. It's something that happened that caused a decline to happen that is treatable, right? And so it can often be confused with, oh, mom just has dementia. She's just getting old. Dad just isn't remembering things anymore because he's 85. Well, none of these things are things that we should just automatically assume. Here's why. There's factors like medication side effects, dehydration, sleep disturbances, vision or hearing impairments, and infections, especially like urinary tract infections. Those can really cause a downtick in cognitive functioning. So these can all cause symptoms that are similar to dementia, but that are reversible with proper treatment.
And what medications can kind of cause confusion or memory issues that mimic dementia?
Yeah, so medications like anticholinergics, benzodiazepines, opioids, corticosteroids, and chemotherapy drugs have all been linked with cognitive impairment. Other less obvious culprits might be antidepressants, sleep aids, antihistamines, and some cardiovascular drugs. So you always want to talk with your doctor and pharmacist about the potential side effects and negative implications that might be causing issues for your loved one. Both of these sections that we just talked about are episodes on their own where we're going to be diving a lot deeper into them. Really, really good information to know on both of those areas.
Yeah, definitely. Stay tuned.
Yeah.
So why is it important to consult a medical professional before assuming a loved one has dementia?
Yeah. So as we've kind of been talking about, there's a lot of things that can cause cognitive symptoms that mimic dementia, but are treatable if identified early. And so a comprehensive medical evaluation, including medication review, lab tests, and cognitive assessments can help determine the true cause, right? Whether it's Alzheimer's or dementia or something treatable. So we always want to have professional medical eyes on those situations.
And there are emotional concerns, or emotional considerations. How can acknowledging a loved one's fear and uncertainty help when discussing their need for assistance?
Yeah. Okay. How do I make this one brief? Because this is, again, this is a big conversation, and we are going to be covering this in a future episode. So our aging adults can feel anxious, embarrassed, resistant to accepting help. I always encourage people to put yourself in their shoes. If you're beginning to decline and you're feeling you're forgetting your keys more often, or you're just not feeling yourself, you're not sleeping right, you don't have an appetite, or things are going on with you, how would you want that conversation to be presented to you? And so, because of that anxiety, perhaps embarrassment, that resistance that we talked about, it's going to be really important to seek help in how to have those conversations, seek the medical help from your providers, and have those conversations in a gentle and supportive way, and start having them early, right? When you start noticing more things happening, more forgetting of the keys, maybe some of those minor things that we talked about earlier, is maybe start having kind and gentle conversations early on. Right.
Yeah. And maybe kind of prefacing it with, we're not ripping away your independence,
Yeah.
So that they can at least, feel relaxed around that point.
Right. We want our loved ones to be partners in their care, not feel like they're being told what to do, and that they have support and not somebody who's taking things away. So again, whole other episode on that. That one's going to be a really good one.
Yeah. And how can family members promote a sense of partnership instead of making a loved one feel like a burden?
Yeah. So to continue that conversation is using words like, I hear you. We're in this together. I support you. This might be something temporary, right? Especially going back to the things that we were talking about with some of the possible treatable causes. It's like, your doctor started you on this medication. I wonder if that has something to do with it. Right. So not jumping to the Mom, you're just
You
getting
gotta
old,
move.
and you're going to have to move, right?
Yeah.
It's like, hey, I've noticed this is going on. Has your doctor prescribed anything different recently? Or, I'm wondering if one of your medications is causing some side effects, so kind of turning away from, I'm seeing that you're experiencing this and you can't remember this. The you conversations are generally unproductive, right? And so if we can bring that away from the you into, hey, let's look at this together. What could be going on here, and be a little more supportive.
Yeah, good point. And maybe have a glass of water while we're talking.
There we go.
Always trying to get that in.
Let's address the hydration thing. While we're
so next steps when a loved one needs help. What could caregivers do if they believe that their loved one needs more support?
Yeah, so document your concerns. This is an important one. We had another episode on how to advocate for your loved one at a doctor's appointment. And I think we said probably 47 times in the episode, preparation, documentation. And so it starts here. When you start noticing things that are going on, just kind of document them. Conversations you've had with a loved one, concerns you might have. And writing those things down, schedule a medical evaluation, and then explore options like, do they need maybe a little bit of in-home care assistance, while you're trying to figure things out. There are adult day programs out there, senior living communities. Now, those last three recommendations are more as people are really kind of struggling, getting a little more advanced, but it begins with observation, documentation, speaking with your medical providers.
What resources are available for caregivers navigating these challenges?
Yeah, so check your local senior communities. Like senior centers are usually a great wealth for resources. Your primary care provider, organizations like the National Institute on Aging has great resources. AARP, your local aging and disability resource centers. You can find local support groups, financial assistance programs. We have everything at our fingertips with the internet. So just start looking for local resources. We'll put as many links as we can to help you in a general direction down below the podcast.
Yeah, not every area is going to have all of these things, but they will have some. How can caregivers balance their own well-being while taking care of loved ones?
Yeah, so I actually really like that question. And that's something you want to start thinking about early. And I will share this with you, is that by the time families come to us, we are known for taking on more complex cases, more high need cases. And so by the time a family comes to us, they were overwhelmed.
Often in crisis.
Self-care is not even on the radar at that point in time. And so we have to help people let go of the reins a little bit and relax, and give them permission to relax and permission to care for themselves, knowing that we can still care for their loved ones and they can still care for themselves. So if there's one key thing that I can give you today, is to start looking at that self-care right from day one. As human beings and as people who care for our aging loved ones, we're going to put them first, and we tend not to cry uncle until we're so overwhelmed, where we should have done that, asked for help a month or two before. And so start looking at that self-care picture. How can you always make sure you're incorporating that right from the get-go?
I mean, there's a reason why on airplanes, they'll tell you to put your oxygen mask on first.
That's right.
Really.
Yeah.
I mean, there's a real reason behind that.
Yeah.
And so what are the key takeaways for families trying to determine if a loved one needs help?
Yeah. So the most important steps are observing changes over time, considering potential causes, both temporary and chronic, seeking professional guidance when necessary. Support and resources are available to you. Seek them out. We'll, like I said, we'll give you links for more of the national resources down below, but you can also seek out your local resources. There's a lot available to you, and understanding that as caregivers, you don't have to navigate this alone. You've got support and help.
And what are the next steps for our lovely listeners if they would like to learn more?
Keep coming back here. So future episodes.
I feel like that was a softball.
That was
for
a
you.
softball. Yeah. Got it. Perfect throw. So future episodes are going to cover topics such as how to advocate for a loved one, both in the emergency room, in the doctor's office, how to avoid emergency room visits.
Yeah. And, this structured approach ensures that you have what you need to move through the early signs, growing concerns, and actionable solutions in a logical and informative way.
That's right.
So document.
Exactly.
We'll say it again.
Thank you so much for joining us today. We appreciate you in each and every episode, and we hope that you learned something. And we want to encourage you to like, share, and subscribe. Share to anybody that may benefit from hearing our podcast.
Sharing is caring.
Sharing is caring. And before we go, we want to thank a few very special people, as always, who have helped this podcast come into being. The first one being
my wonderful husband, Wade, who has got that velvety voice at the beginning, and you'll hear it in just a second.
That's right. Thank you, Wade.
Thanks, Wade.
I want to thank my daughter, Devin, for designing our logo and our merchandise.
Thanks, Dev.
The branding is fantastic. And also thank my amazing friend, Jeff Leisawitz, for the music that he wrote just for this podcast. And I want to thank my awesome co-host, Paige.
My awesome co-host, Stephanie. Look at her. She's amazing. Look at that necklace.
We are having so much fun bringing you this podcast, and we can't wait to bring you many more episodes in the future. Thank you again for being here, and we'll see you on the next episode.
And call your mom.
Call your mom. Bye.
Thank you for joining us on this episode of Your Silver Lining. We hope today's discussion was insightful and empowering. Aging isn't just about getting older, it's about embracing the journey and making the most of every stage of life. Through it all, we've got you. If you enjoyed this episode, please like, subscribe, and share it with anyone who might benefit. Your support helps us reach more people. Have a topic you'd love us to cover? Send us a message. Let's continue the conversation. Connect with us on social media or visit our website at yoursilverliningpodcast.com. Join us next time as we keep supporting you and caring for your loved ones. Until then, stay positive, be well, and remember, we are your silver lining.